Hello, doctor. Welcome to the Health Site, and thank you so much for joining in.
Thank you, Sakshi, for having me today.
All right, doctor, as we know, the entire month of October is marked as Breast Cancer Awareness Month. The entire month has been marked for that. So, my first question will be very basic, though we'll be discussing a lot of things about breast cancer today. But the very basic question: what is the significance of Breast Cancer Awareness Month?
Well, I think the incidence of breast cancer is increasing world over, especially in India, for various reasons. And almost 1 in 8 women get breast cancer, even in our country now, as the time goes by. So it's very important that we dedicate 1 month to understanding breast cancer and how we can detect it early, and that will help in saving a lot of lives. So it's very important that we have this breast cancer awareness month.
All right, doctor, moving on to the detection part. How to detect that somebody has got breast cancer?
So there are two things. One is patients who have a lump in the breast. If you are feeling that there is something abnormal in your breast, a lump, then make sure that you go and see a doctor. It might be a benign lump, it might not be a cancer, but never neglect it. You must go to a doctor. Now, coming to early detection, where we want to detect something in the breast even before we feel a lump. And there we can do either a breast mammography or an MRI of the breast, depending upon the patient's risk factors and family history. So for most patients, the recommendation now is to do what we call a screening mammogram, at least starting at the age of 45 and once every year or every 2 years, so that anything that is early and small in size can be detected, and we will be able to treat and cure patients.
Doctor, if we talk about the stages of breast cancer, what are the stages of breast cancer?
So, breast cancer has 4 stages: 1, 2, 3, and 4. This depends upon both the size of the tumor, where it has spread to, and how much it has spread. So, stage 1 overall is the tumor that is localized to the breast itself. Stage 2 and 3 are where the tumor is slightly bigger in size, or the tumor has spread from the breast to what we call the lymph nodes, that is under the arm, axilla. So stage 2 and 3 are those patients where the tumor has spread from one place to the other, typically to the axilla. If the cancer has spread beyond the breast and underarm to different parts of the body, sometimes it can spread to the brain, to the lung, to the bones, to the liver. So based on where it is spread, we call it stage 4. So stage 4 is when it has spread to a lot of places. Stage 1 is when it's limited only to the breast. Stage 2 and 3 are when it is slightly bigger in size and gone to the underarm.
Doctor, talking about the treatment, what are the treatments that are involved in breast cancer?
So in the past, we used to have one type of treatment for all patients with breast cancer. But now it has changed a lot. So I have a very long answer for your question.
So,
I will start
doctor,
with.
it would be good if you tell what was the treatment earlier, what was done before, and what are the new treatments which has come down now.
Correct. So there are nowadays, we know that breast cancer is not one, but it's many types of breast cancer. So even amongst breast cancer, we have different types. And it's very important to know for the patient and for the doctor what type of breast cancer you have. So you can have what we call hormone positive breast cancers. These cancers respond very well to hormone tablets. We have what is called HER2 positive breast cancers. These cancers respond very well to what we call anti-HER2 therapies. And then we have triple negative breast cancers, where we rely a lot on chemotherapy. So knowing which type of breast cancer you have, hormone positive, HER2 positive, or triple negative breast cancer, is very important. So step 1 when you have breast cancer is to know what type of breast cancer you have, and I've told you the 3 types. Step 2 is to know what stage it is. Is it stage 1, 2, 3, or 4? And step 3 is when we come up with the treatment plan. In the treatment plan, as a doctor, I have to make 3 decisions. 1 is, does the patient need surgery? 2, does the patient need chemotherapy? 3, does the patient need radiation? So these are the different types of treatment that we have for breast cancer. So if we go to surgery for breast cancer, many times we hear that patients have are scared that their entire breast will be removed because they have a breast cancer. But nowadays we have different ways and means of saving the breast, what we call breast conservation. Sometimes we give some treatment beforehand to decrease the tumor in size. Sometimes we might do some talk to the plastic surgeon and do another kind of a therapy where we can conserve the breast. So in surgery, for the treatment options, we have both breast conservation and mastectomy. In big cancer centers and established cancer centers, we do what is called a sentinel lymph node biopsy. So in breast cancer patients, we hear many times patients come saying, will my arm be swollen? I have seen somebody with a big arm after the breast cancer surgery. And that happens when we remove a lot of lymph nodes from under the arm. So when they have a lot of swelling in the arm, it becomes a big problem. So nowadays we do what is called a sentinel lymph node biopsy, where we put a special dye in the breast and track the lymph nodes. So we remove only 1 or 2 lymph nodes for the patient. And in many patients, we're able to do this procedure. So the first type of treatment that we consider for breast cancer is, does the patient need surgery or not? And if they need surgery, is there any way that we can do breast conservation and avoid mastectomy and axillary lymph node dissection? The second treatment for breast cancer is for radiation. And there are some patients who need radiation, patients who have big tumors or multiple lymph nodes that are positive. And there are different types of radiation which the patients can discuss with their radiation oncologist on what would be best and safest for them. The third treatment for breast cancer is what we call systemic therapy. If I do surgery or radiation, I'm removing the tumor from the breast. But when we give systemic therapy, it removes tumor from everywhere else in the body, any cells that are hiding anywhere. So here we can do chemotherapy. The advances that we have, one is in hormonal therapy. So patients who have hormone receptor positive breast cancer, we now have many different types of tablets and injections that we can give, which will make sure that the risk of recurrence, the cancer coming back, is decreased. In addition, in patients who have HER2 positive breast cancers, we are now giving what is called anti-HER2 therapy. And we have different types of anti-HER2 therapies which we discuss with the patients on what is best for them. Those who have the triple negative breast cancers, some patients we consider giving a new drug called immunotherapy also. So it's not a simple answer on what is the type of treatment that is available for breast cancer, because based on the type of breast cancer and the stage of breast cancer, we will have to have multiple decisions that need to be made.
Yes, doctor. And doctor, so this was this episode. I think we have discussed the identification process, detection process, the symptoms, and also the main thing, the treatment of breast cancer. And of course, I wish to connect with you in future also to discuss about breast cancer. So let's end this today, and I look forward to discuss more about breast cancer with you.
Thank you very much, Sakshi.
Thank you so much, doctor. Thank you so much.